and use the negative pressure from the syringe to get the sample. You might need multiple insertions to get the adequate sample. If you get adequate sample, put the sample in a glass slide and use another glass slide. Place another glass slide perpendicular on top of the sample to secure the sample. For the elliptical incision, use a deserting forceps to secure the skin tag or the tissue in place as soon as we go through with the incisions. Carefully cut through the edges of the skin tag. Make a V shape on both the edges of the incision. Cut through the subcutaneous tissue within the edges of the incision and carefully remove the skin tag as shown. For the incision and drainage, the first step is to clean the area carefully with clean the area that is to be incised, and next step is to put a generalized linear incision. As soon as we incise the lesion, it might cause a sudden ooze out of the pus. You might want to clean that first the pus that comes out. If it doesn't come, you might have to pop it a little bit so that it will come out. As soon as you clear the first uh, drainage, you have to take a little bit of the sample for the culture. Next, you might want to you have to uh, press all the pus and all the lesions out completely and clean that area with a gauze pad. Now drain the wound with hydrogen peroxide and irrigate it clearly. Now use a gauze pad to stuff inside the wound carefully. For a local anesthesia, you need an anesthetic drug like a lidocaine and a syringe. First of all, get the local anesthetic drug to the syringe and remove the needle and get a new one. Then carefully put the syringe to the area where you want to anesthetize. Put the needle on the outer surface of the tissue and then go deep. Carefully put the drug. Make sure you cover all the surface, all the area you want to anesthetize. First, we need to put the tourniquet. Ask the patient to make a fist. Flex the fingers. Flex palm. Then clean the soft where you're going to put the IV. Tap the area to make the veins prominent, and try to put the IV cannula into the vein. As soon as you see the back flow of blood, you remove the needle and uh, close the valve, and then put the tape and fix the cannula in place, and put more tape to fix uh, the cannula, and then remove the tourniquet.
So for nasogastric tube insertion, introduce yourself to the patient, ask consent from the patient, and then ask patient to sit in upright position. Now use the NG tube and then measure the length, measure the desired length from tip of the nose to the earlobe and 5 centimeter below the XP sternum. Now measure the length. Now check, now lubricate the tip of the tube. Now start inserting the tube via nose. Check in the mouth. Ask patient to swallow the water drops. Insert the tube until the desired length, and then gather the gastric content for the pH and stabilize the NG tube. Thank you. In the Foley catheter incision, for that we need a Foley catheter. Need to open the Foley catheter. Now put a paper inside below the patient. Now use a sterile cloth to clean the penile area. First up and down, and then round circle. Give it some time to dry. Now lubricate the tip of the catheter and then hold it in your hand like this. Get the tip of the catheter with your index finger and thumb. Put it inside the urethral opening. Stop until you see the urine coming out. Now inflate the balloon. Now put the catheter back and secure it. Thank you.